Welcome to the online module for crossover youth. This module provides child welfare professionals with an overview of crossover youth using a developmental ecological framework. Our project team at the University of Minnesota School of Social Work includes Wendy Haight, Professor and Campus Kogumo Chair, and Min Jo, myself, PhD Graduate Research Assistant. We are grateful for the financial support of the Campus Kogumo Endowment and federal Title IV funding through the Minnesota Department of Human Services and the Center for Advanced Studies in Child Welfare. This module has 5 learning objectives. We would like our viewers to be able to understand, first, key characteristics of crossover youth. Second, their pathways from childhood maltreatment to delinquency. And third, a developmental ecological framework on risk and resiliency that integrate insights from various interdisciplinary perspectives to understand maltreated youth crossing over. We will also review some existing interventions for crossover youth. Last, we will discuss implications for social work. In the previous modules, we provided a series of research outcomes about crossover youth as listed in this slide. We are going to begin with the definition of crossover youth. There are many different terms referring to youth involved with both child welfare and juvenile justice systems, such as dually involved youth, the dependent delinquency population, and crossover youth, to name a few. In this module, we will use the term crossover youth, which is defined as any youth who has experienced some form of maltreatment and also engaged in delinquency. The Center for Juvenile Justice Reform at Georgetown University clarifies the definitions of each term as pictured in this slide. Crossover youth is the broadest term, which refers to any youth who experienced maltreatment and engaged in delinquency. Dually involved youth is a subgroup of crossover youth who are simultaneously receiving services from the child welfare and juvenile justice system. Their system involvement may be informal or preventive, such as voluntary in-home services from the child welfare system and informal diversion in the juvenile justice system. Or it may be formal, like services resulting from confirmed child abuse or neglect case in the child welfare system, or confirmed delinquent act in the juvenile justice system. Dually adjudicated youth is a subgroup of dually involved youth, formally processed by and under the formal care and control of both systems. Youth may cross over from either system, but most of the cases, about 92%, are youth who are first involved in the child welfare system and in the juvenile justice system. From previous research about youth involved in both of these systems, we know that maltreatment places youth at risk for delinquency. Maltreated youth are 47% more likely to become involved in delinquency than youth from the general population. Repeated maltreatment also further increases youth's risk of delinquency and reoffending. Involvement in the juvenile justice system further compounds their risks, for example, through exposure to delinquent peers and stigmatization. Given those multiple risks, it is not surprising that crossover youth show a range of problematic developmental outcomes, which includes poor educational outcomes, mental health problems, substance abuse, and suicidal ideations or attempts. For example, in Los Angeles County, approximately 56% of crossover youth had mental health problems. Also, even though the majority of crossover youth were enrolled in school, more than half of them did not attend regularly. In Arizona, 80% of crossover youth had substance abuse problems. 61 had a history of prescribed psychotropic medications, and 27% reported suicidal ideations or attempts. Such problematic developmental outcomes extend into adulthood. In New York City, during the transition to adulthood, crossover youth tended to become involved with multiple systems, including healthcare, homeless shelters, and cash assistance. Although the issue of crossover clearly affects a substantial number of youth, obtaining accurate data on the prevalence of crossover youth is challenging for a number of reasons. First, child welfare and juvenile justice systems typically do not share information. Second, as we already reviewed in the previous slide, the term crossover youth has been defined differently across empirical studies. Third, there are various methods to measure prevalence according to the type of data and starting point at either the child welfare or juvenile justice system. To be more specific, the use of self-report data yields higher prevalence than administrative data. Also, higher prevalence are reported as youth become more deeply involved in the juvenile justice system. For example, in Arizona, youth with maltreatment histories comprised 1% of delinquent youth who received informal diversion, 7% who received probation supervision, and 42% who received probation placement. Children with maltreatment histories are at increased risk for involvement in delinquency, but clearly a substantial number of these children do not go on to commit delinquent acts. The question is, why some maltreated youth engaged in delinquency while others do not? Understanding the source of such individual variation is important for the development of effective interventions to prevent or ameliorate the impact of crossing over. Individual variation in the involvement of maltreated youth in delinquency likely results from differences in exposure to risk and protective processes, as well as the developmental timing of these experiences. Risk processes increase the probability of onset, digression to, or maintenance of delinquency. On the other hand, protective processes such as positive relationships with others can moderate the effect of risk processes so that more positive developmental outcomes may occur. However, the impact of risk and protective process is not a simple linear function. It may vary with development. In other words, risks to development can be particularly harmful during periods of rapid development. For example, parent-child attachment relationships are particularly vulnerable to disruption through foster care placement in infancy or early childhood when rapid development and significant reorganization of these relationships occur. In addition, the impact of risk and protective factors may vary because children respond in different ways to the socialization messages they receive from parents or peers. For example, actively embracing or rejecting anti-social beliefs of parents or peers. There are a number of theories that identify potential risk and protective processes in a developmental trajectory, from childhood maltreatment to delinquency. First, general strain theory from sociology describes child maltreatment as a potent strain. Experiences of strain generate negative emotions such as anger, depression, and fear. Such negative emotions lead to low social control, and create pressure or incentive for adolescents to relieve these feelings through criminal coping. Second, trauma theory from psychology is also used to explain the association between childhood maltreatment and delinquent behavior. In trauma theory, the most serious effect of trauma is a weakening of executive function, which is the individual's ability to regulate emotions, thoughts, and behaviors. Children traumatized by maltreatment may develop maladaptive emotional mechanisms and experience problems regulating emotions and behaviors. As a result, they may become impulsive, self-destructive, and thus engaged in impulsive behaviors or self-destructive behaviors to regulate emotions such as substance abuse. Social learning theory argues that delinquency results from learned attitudes and behaviors typically at the family level. Children learn deviant or aggressive behaviors from their maltreating parents or caregivers, as well as the acceptability of openly expressing hostility or disregard for others. Social learning theory highlights a cycle of violence. Some victims internalize maladaptive beliefs and attitudes about violence, which are expressed in subsequent abusive behaviors in other relationships. Social control theory suggests that consistent social bonds to family create a propensity for socially acceptable behavior. According to social control theory, crime occurs when such social bonds are weakened or not well established. Parent abuse or neglect deprives their children of opportunities to develop mutual relationships of commitment, trust, and obligation. As a result, their children are more likely to experience low self-control, including impulsive, risk-taking, and short-sighted behaviors. In other words, they become prone to delinquent behaviors. Social control theory provides insight into how social bonds can protect maltreated children from engaging in delinquency. On the other hand, social bonds can promote delinquent behavior, for example, within adolescent gangs or families involved in the use and production of illegal drugs. In summary, there is no unifying or comprehensive theory that explains various pathways from victim of maltreatment to perpetrator of crimes. Existing theories generally focus on the individual and the immediate social environment, with less attention to the larger social structures in which maltreated children experience risk and protective processes for delinquency. Also, most theories are not developmental and provide little insight into children's emerging capacities to actively respond to risk or embrace protective processes. In this module, we use a developmental ecological framework that integrates insights and data from various interdisciplinary perspectives to understand the involvement of maltreated youth in delinquency. As we discussed in the previous slides, maltreated children are active in their own development. They may take any variety of stances towards the beliefs and behaviors to which they are exposed, ranging from passively accepting or actively embracing to rejecting those socialization messages. In addition, when we discuss the issues of crossover youth, we need to consider the socio-cultural context in which youth development is comprised of multiple embedded and interacting social systems, including family, neighborhood, school, and other child-serving institutions, and larger social cultural and historical systems. For example, maltreated children observe and participate in a rural drug subculture when parents use drugs at home in front of them and involve them in stealing ingredients for the production of methamphetamine. Some of these children clearly embrace these activities and underlying beliefs, while others are deeply distressed by them, and still others actively seek out pro-social people, beliefs, and activities. Empirical research on crossover youth suggests individual-level risk and protective processes for maltreated youth's engagement in delinquent behavior. Maltreatment can increase children's risk of disabilities, for example through direct trauma to the brain and the adverse effects on brain development caused by exposure to interpersonal violence and neglect. Statistics for crossover youth indicate that maltreated children are at increased risk for disabilities. 75% of crossover youth in Minnesota and 40% of Arizona crossover youth had a documented disability. In contrast, national data indicates that 11% of the general population of school-aged children, 30% of the child welfare only involved youth, and 33% of the juvenile justice only involved youth have documented disabilities. So, maltreated youth with disabilities may experience additional risks for delinquency due to the academic and social challenges of disabilities at school. On the other hand, those with strong academic and social abilities may experience protective process from delinquency due to school-based affirmation and relationships. There are a variety of family-level risk and protective factors for delinquent behaviors. Maltreated youth with multiple chronic family problems may experience additional risk factors for delinquency, including damaged relationships with adults. On the other hand, those with fewer family problems may experience protective processes from relationships, for example, with grandparents and extended family members. 72% of crossover youth in Arizona had parents who abused alcohol or drugs. 34% had parents with emotional or mental health problems. 53% had either both parents incarcerated, and 60% had experienced a history of domestic violence in the family. Some research suggests that neighborhood-level risk and protective processes may moderate the relationship between child maltreatment and delinquent and criminal behaviors. Socially disorganized neighborhoods with high levels of social isolation, economic deprivation, and other adverse circumstances can create risks to delinquency or crime by weakening children's social bonds to key socializing institutions. Such neighborhoods may be unstable and inadequate for collective monitoring and supervising of children by adults, as well as for providing positive role models. Some research indicates that maltreated children from more disadvantaged and unstable neighborhoods were arrested at a rate of 1.5 times higher than maltreated children from less disadvantaged and more stable neighborhoods. Neighborhood disadvantage is usually measured by the percentage of families in poverty, families receiving public assistance, unemployed residents, female-headed households, and residents from ethnic minority groups. Residential stability is measured by percentage of owner-occupied and non-movers in the past 5 years. Neighborhood characteristics also can be protective factors, and the existing studies suggest that the effect of positive neighborhood characteristics, social cohesion, and collective efficacy moderate the link between child maltreatment and aggressive behaviors. For example, neglected youth with lower behavioral problems lived in neighborhoods with higher levels of collective efficacy. Collective efficacy indicates the level of shared trust and willingness of neighborhood residents to engage in social control. Maltreated youth also may experience risk and protective processes for crossing over into delinquency within a variety of institutions, including the child welfare and school systems. First, the child welfare system is one of the most important contexts for crossover youth, as a majority of them are in out-of-home placement. Empirical research suggests that out-of-home placement, the number of changes in placement, and type of out-of-home placement affect risk for delinquent behaviors. All crossover youth in 2 Arizona counties were in out-of-home placements within an average number of 10.3 placement moves. 98% of crossover youth in Los Angeles experienced at least one out-of-home placement, and 62% had at least one group home placement. In Cook County, crossover youth with at least one group home placement were approximately 2.5 times more likely to engage in delinquency than those who did not experience group home care. This slide shows school-level risk and protective processes for delinquency among maltreated youth. Protective processes at school include positive interactions with school, attachment to teacher, extracurricular activities, and good attendance. Risk processes include out-of-school suspensions and characteristics of peer groups. In Washington State, neglected youth with prior out-of-school suspensions were 2.7 times more likely to engage in delinquency than those who had not been suspended. School is also important context for peer groups. Maltreated youth who are associated with antisocial members and gangs had higher risk for delinquent behavior. In contrast, those who reported consistent friends or companions or association with pro-social friends were less likely to engage in delinquency. Social culture and historical context also present risk and protective processes. Issues associated with race, social class, gender can intersect to create unique life experiences for marginalized people, including maltreated youth. For youth involved in both child welfare and juvenile justice systems, issues of poverty often intersect with race and gender to compound risks due to maltreatment. Empirical research indicates that African American youth, as well as other youth of color, are overrepresented in the crossover youth population relative to the general child welfare or juvenile justice populations. African American youth experience deeper entrenchment than European American youth in both the child welfare and juvenile justice systems, with findings in specific locales ranging from 1/3 to 13 times more likely to be involved. Issues surrounding gender also create risks for delinquency among maltreated youth. Males are more likely to cross over to the juvenile justice system, but females comprise a larger proportion of the crossover population than the delinquent population. For example, females comprise from 33% of the delinquent population in Los Angeles County, 40% in King County, but only 29% of the delinquent population nationally. Longitudinal data also suggest gender-specific risk pathways linking child maltreatment with criminal behavior. For example, even though child maltreatment only predicts juvenile delinquency in males, child maltreatment predicts adult crime for both genders. In explaining these gender differences, scholars suggest that females are more likely to internalize trauma from maltreatment, resulting in delayed criminal behaviors, while males are more likely to externalize trauma and more immediately engaged in delinquency. Although relatively little research has focused on crossover use in various cultural contexts, both child welfare and juvenile delinquency are global societal concerns with serious consequences. However, international comparisons are complex because how child maltreatment and delinquency are defined and understood, as well as appropriate societal responses, vary widely across cultures. Relationships among family members in most Asian cultures typically are influenced by Confucianism. These relationships tend to be hierarchical. Children are expected to respect and obey their parents and to show filial piety, that is, to return parental love and sacrifice. In this context, children's unquestioning obedience to parents, strict parental discipline, and emotional moderation are valued as ways to maintain hierarchical relationships. Children's misbehaviors may be regarded as a lack of parental discipline. Even severe corporal punishment, such as slapping the child on the face or kicking, can be viewed as parents' sincere concern and response to children's misbehaviors. In other words, the boundary between acceptable parental discipline and child maltreatment may be ambiguous. Recent research in Asian contexts also suggests cultural variations in pathways from maltreatment to delinquency. In South Korea context, teachers' physical and emotional punishment and examination-related strain were significantly associated both with violent and property delinquency, which reflects the high priority placed on academic achievement in obtaining status, the amount of time spent in academic pursuits, and the importance of teachers. In Chinese culture, there is no legal definition of child maltreatment, and thus general criminal law or juvenile protection laws are referred to in order to deal with very serious child maltreatment cases. Based on these cultural variations, scholars suggest that negative emotions produced by parental maltreatment alone does not increase delinquency in these cultural contexts. So, further studies should examine additional negative emotions as mediating effects, such as anxiety, shame, or frustration, because the level of acceptance of certain emotions may vary considerably across cultures. Solutions to crossing over are likely to be found at and impacted by each of these interacting ecological levels. However, existing interventions tend to focus on micro or macro levels of interventions. First, multidimensional treatment foster care is an intervention model for delinquent youth in aggregate care settings, which is designed to enhance positive interactions between caregivers and youth and caregiver monitoring and supervision skills to improve youth's prosocial behavior. Empirical research supports its effectiveness in reducing the length of days in locked setting and referred to the juvenile court at a 12-month follow-up among the intervention-involved girls. Second, the Positive Peer Culture Program is a residential program designed to teach healthy norms, prosocial attitudes, and behaviors through positive youth culture. However, existing research suggests that these programs are less effective in reducing reoffending for maltreated youth. Currently, there are two system-level interventions. First, Project Confirm is a program implemented in New York City to reduce unnecessary detention of foster youth by utilizing notification and court conferencing. Through notification and court conferencing, juvenile justice officers and the program staff share youth's identifying information to determine whether the youth is in foster care, and ensure that child welfare representatives and their counterparts in the juvenile justice system know their roles in responding to a case involving a foster youth. Empirical research indicates that Project Confirm was associated with reduced detention rates among less serious offenders, but not among serious offenders. Second, the crossover youth practice model targets multiple ecological levels to minimize the involvement of maltreated youth in the juvenile justice system. It is designed to promote collaboration mainly between child welfare and juvenile justice systems for early identification of crossover youth and provide existing services earlier and in an individualized manner. Youth and family engagement is also fundamental to this intervention. Empirical research indicates the program reduced reoffending among crossover youth in Minnesota over a one-year period. Here are some implications emerged from the overview of crossover youth. First, effective interventions that change crossover youth's negative developmental trajectories require an understanding of risk and protective processes for maltreated youth crossing over into delinquency, as well as the various pathways from maltreatment to delinquency. Second, understanding of crossover youth requires a developmental ecological framework to integrate insights from various interdisciplinary perspectives as they actively respond to risk or embrace protective processes. Third, both child maltreatment and juvenile delinquency are global societal concerns with serious consequences. However, how child maltreatment and delinquency are defined and understood differently, and appropriate societal responses also vary widely across cultures. For child welfare professionals, cultural sensitivity is required in order to work with crossover youth and their parents from different cultural backgrounds. Based on what we learned from the previous studies and lessons from the overview of crossover youth, our ongoing research is to examine early indicators such as school problems, type and timing of child welfare involvement that predict entry into the juvenile justice system. The research goal is to develop and enhance the interventions to prevent or interrupt youth crossing over from child welfare to juvenile justice involvement. For your information, here are a list of references cited in this module.